wash my hands. Can I just, I'm going to check your identity. Can you tell me your full name and your date of birth, please?
Tanya Thomas, 11/22/1940.
Okay, great. I'm going to do a quick assessment. I want to make sure that you have no drainage from your
I hope not.
incision. Okay, perfect. Are you in any pain?
No, not right now.
Okay. Let me know if you're in any pain while I'm doing these exercises, okay? Because we need to stop if you are.
All right.
Okay.
The physical therapist performs hand hygiene before beginning the exercises. She only exposes the limbs to be exercised. The bed is raised to a comfortable position for the patient and the PT in order to use proper body mechanics and prevent injury. The PT will perform a series of exercises that will include flexion, extension, hyperextension, rotation, lateral flexion, abduction, adduction, circumduction, supination, pronation, opposition, inversion, and eversion. The physical therapist will follow the appropriate sequence of exercises starting with neck, shoulders, elbow, forearms, wrist, fingers, thumb, hip, knee, ankle, and foot. She will also perform the exercises slow and gently and will support the joint while performing exercises. She will repeat each movement 5 times, and after completion, she will reposition the patient, lower the bed to a safe position, and perform hand hygiene. Proper documentation after procedure will be done in the patient's chart, and any unusual findings will be reported to the nurse so that the doctor is aware.
Okay, how are you feeling, Tanya?
Fine.
Okay, good. And remember, at any time, if you're getting uncomfortable, if you're in any pain, let me know so we can stop, okay?
All right.
Okay, very good. Now, this concludes our session, and I want you to keep practicing these on your own, okay?
All right. Thank you.
No problem. Thank you.
An important tool for providing quality care to patients is the importance of hand hygiene. It is very crucial that any healthcare provider washes their hands before giving care and after they have given care. The prevention of spreading deadly diseases and infections can be done by washing our hands. Family members visiting their loved ones in the acute care setting are always encouraged to wash their hands as well, especially when the patient has a contagious infection or disease. In this scene, the certified nursing assistant will be demonstrating proper hand hygiene after providing care to the patient.
Okay, Tanya, I'm all done making your bed. How are you feeling?
Fine, thank you.
Okay, good. I'm gonna lower your bed.
The CNA exits the room, disposes of the trash in its appropriate bin, and discards her gloves. She then performs proper hand hygiene. First, she inspects the surface of hands and fingers for cuts or breaks. Inspects hands for visible soiling and own nails for condition and length. She removes any jewelry and pushes any clothing or wristwatch above wrist level. She then proceeds by standing at the sink without touching the sink with hands or uniform, turns the water on, avoiding any splashing, regulates water flow, adjusts water temperature to warm, wets hands and wrists, keeping hands and forearms lower than elbows, applies antiseptic or liquid soap to hands, lathers hands, and applies friction to the skin for 10 to 15 seconds on each hand. She interlaces her fingers and rubs palms and backs of hands in circular motion, cleanses thoroughly under fingernails, and rinses completely. She dries hands thoroughly, wiping from fingers up to wrists and forearms. She then turns off the water at the sink with a paper towel or pedal and discards paper towels properly.
Now I'm going to introduce our cast. The registered nurse was Keisha Hall. The licensed vocation nurse, Tracy Selby. The nurse assistant, Sherry Martineau. The patient, Tanya Thomas. The student nurse, Tyson Likens. The nursing instructor is Keisha. The narrator, Laura Robillard. The director and creator, that would be me. And the camera director, Amy
McMahon!
and the script writers, Keisha and myself.
We're graduating.